Hello. We have today another amazing episode of interviews at our Digital Health Inside Out channel. Um, Traditionally, I'd like to remind you to subscribe to our channel. Sergey is very sad when you guys watch our episodes and don't subscribe. So let's not make Sergey sad, please.
I don't care.
Uh, Thanks, Sergey. Uh, As you already understood, we have traditionally with us my co-host Sergei Polevikov. How are you doing, Sergey?
I'm good. Everybody's good.
Awesome. And I'm super excited to introduce you to our today's guest. His name is Piotr Orzechowski. How are you doing, Piotr?
Excellent. Thanks for having me.
Yeah, I'm really looking forward to this conversation. Uh, Traditional, let's start a little bit about your background. Tell us, how did you get into health tech? How did you come up with the idea of creating Infermedica? And yeah, where are we today with the company?
Oh, perfect. Pleasure to be here again. My name is Piotr. I'm a founder with technical background. I was born in Poland, in Wrocław. I still live in Wrocław. This is where I decided to stay and base the company from. The story is quite long. Since I was 7 years old, I started programming. My father is a professor of chemistry, and he would bring old computers to our house. This is how I would pick up coding. And long story short, I developed this passion for developing games. And I always wanted to be a game developer, build something from scratch, build your fantasy worlds. But once I got to college, I also realized that solving business problems is very interesting. I graduated from computer science and software engineering, and shortly afterwards, I was a CTO of a Polish clone of Dropbox. So I co-developed this algorithm to store and sync files in the cloud. It was actually, it was very early on, but it got acquired by the largest web portal in Poland. And from then, I was looking for a new thing to do. And once upon a time, I came across this online version of 20 questions. So literally an online game. I was playing it with one of my friends who is a medical doctor. And we asked ourselves, wow, this genie is so clever. This genie can always guess the person we're thinking about. How about we do something useful for other people? Maybe we can turn it into symptom checking genie and replaced so-called Dr. Google. And this is how it all started back in 2010. I managed to combine my interests in interactive playable games and my computer science background to actually start my company. And this is how Infermedica was born.
Awesome. So when I Googled your name, I got a jazz musician with the same name, Piotr Orzechowski. So all my questions are about jazz and history of jazz. Hopefully you know a lot about that.
I actually have some musical training, but the other Piotr, he's a phenomenal pianist, just pianist of the new generation, young generation. I actually saw him once in a concert, and I approached him afterwards. I said, "Hi, my name is Piotr Orzechowski." He got a little confused, to be honest, but he's absolutely brilliant musician. If you haven't had a chance, this is the smarter and more famous Piotr. So check him out.
Awesome. And another shameless plug, Wrocław is my one of my most favorite cities on earth. Anyone who is viewing this episode, you should definitely visit.
Uh,
And when you do that, there is a fun thing to do is looking for mini statues of dwarfs all over the city. This is like one of the most fun thing you can be doing when coming to Wrocław. So highly recommend. So amazing place for sure.
oh no, but this is it's a really great place to live. And this is where I was born. This is where my family is from. So nice, nice. And this is true about dwarfs. Whenever you want to visit something in Central Europe, I think Wrocław is a very good spot to have on your map.
Highly recommended.
Were
Thank
there
you.
any other comical episodes or some fun episodes with your name? Confused with the jazz musician, or
No, not really, but I get it once in a while. I even reached out to him once and said, look, maybe we can play in a duo. I'll play guitar, you'll play piano. He was even pretty open to it, but of course that was more of a joke.
Yeah,
He's a pro.
yeah, it's funny. So let's switch gears a little bit. You mentioned that you started your company as a symptom checker, and of course you mentioned Google. There's also WebMD, and it's been a while. It's been a while. It's what is it? 2012. Category has changed. When we interviewed Shiv Rao a few weeks ago for this podcast, he actually tried to avoid the name AI Scribe to describe his company. You're saying things like, call a bridge company that's built around clinical conversations, care delivery, and you can also call it billing and coding system. And I'm curious, it's been a while. I feel like, because I've been in kind of the same kind of industry now for 6 years, and it seems like there are certain people that have almost like negative connotation to when you say symptom checker. So I'm wondering if you still kind of like consider yourself in that category, or has category evolved over time?
Yeah, great question. I think the category evolved over time quite a lot. And I think this is a very important question. So maybe I want to spend a moment here. I almost think that this category of a symptom checker is literally dead. I think it doesn't exist anymore. It's not like it happened this year, it happened over years. But if you're building, let's say, the next WebMD, some consumer type of thing that's standalone, that lets people check their symptoms, it doesn't exist anymore. Everybody, including myself, would go to ChatGPT, Claude, Perplexity, you name it, and people will simply use the tools that are most convenient. So a standalone symptom checker use case, in my opinion, doesn't make sense. However, what's interesting is AI triage is still very important. Actually, the interest that we're seeing is growing. And where we see demand is when somebody is looking for a clinical grade component that's deeply integrated into how you serve patients. Maybe that's a part of how you book an appointment, how you choose the service you want to book. Maybe this is as an intake collection ahead of the visit. Maybe this is as you talk to a nurse and the nurse is using the triage tool to provide like standardized assessment. It might be after discharge from hospital. You want to follow up with patient, triage any new symptoms. Maybe there's some fever. Maybe there's something happening around the surgical area. And only when this technology behind symptom checking, in my opinion, is integrated in a real workflow, it generates value. In all the direct-to-consumer cases, I think everybody will go to OpenAI, Anthropic, you name it.
There's been some competition that's been having troubles in this field, and I wrote about Babylon. Went down, dramatically. Bayou had a downsize around. Who else? Yeah, Ada had some layoffs. It's been a tough time the last few years since 2021, since COVID, basically. And I was like, you mentioned like seems to be like integration and this workflow seems to be the mode, the differentiator. But is it really the case when like anyone can kind of vibe code? And again, it sounds bad, but like basically, for $20 per month on Claude, you can kind of vibe code whatever symptom checker, and kind of like at least like on the surface do the same thing. So I'm curious, with all these players that are still left, like how can they compete? First of all, with so many like just individual like entrepreneurs coming in, and also big guys like OpenAI and Google kind of getting into medical field and including diagnostic and medical reasoning more and more. It seems like it's a tough field. So how are you surviving? Like what are you doing differently?
Mm-hmm. Yeah, so I think there are even a few questions in this one question, Sergei, but we can approach it from different angles. Maybe let me go back a little bit also to the previous question of how people check their symptoms, and maybe I'll start with the LLM angle. So what do we offer that is relevant in the age of ChatGPT and Claude and so on? Because this is the foundation for the future. So I think there are 3 reasons. And this is not only about being integrated into the system, but there are like basically 3 reasons, very important, for which our business exists today. First of all, we are clinician-built and validated. So it's not automatically trained. This is a very careful human curation process, which is slow, which is of course mundane. We've spent over 150,000 hours of physician input manually assembling the graph. And what it means is we can sign off on it. There is no hallucination. We know that doctors did proper job sourcing information from literature publications, and we can trust it. And this point number 1, so clinician built and validated, is what enables us to have a medical device status. And this is super interesting. And keep in mind, Infermedica operates in more than 35 countries. US is one of them, definitely very, very important market. But in pretty much all other countries, the regulatory and compliance is much stricter, much higher than, even if you look at Canada, it's much stricter than the US. So we are the Class 2B medical device in the European Union, and EU sets, I would say, the most rigorous standard for classification. We need to have this external auditor, ISO processes, quality management system, and securing this Class 2B medical device means we are fully responsible for the medical advice we provide. So first of all, getting this medical device status is nowhere possible right now on the roadmap of ChatGPT, Perplexity, or Claude. It's absolutely impossible to show right now, at least, the management surveillance process and lack of hallucination that makes it safe to use and be checked off by auditors. And then, and this is super important for our clients, partners, we take responsibility for mistakes that we do. So to date, we had more than 27 million people who have used Infermedica to assess their symptoms, to triage their symptoms. And if there's something wrong, if there is harm, and Class 2B is for devices that can cause serious harm. So we are in this category if we say, oh, you don't need to go to emergency, and that was wrong. If the harm is, of course, unfortunately appears, then we are the ones responsible. And it's very difficult to approach enterprise clients, health systems, governments. We work with governments. It's very hard to approach health systems without this notion of accountability that you have, that we provide as a vendor, but they cannot get the same level of accountability from LLM providers. And we can only do it because we're clinician built. We know it's safe. There's no hallucination. We've got the medical device status, and that defines the fact that we take responsibility for it. So, and this is the starting point. And this is why we're only seeing more and more interest in our technology. I have to tell you, times have been tough post-COVID. And you mentioned, Sergei, that many different companies have some challenging periods. We had a challenging period too. I'm not going to hide it. This is the truth. This is how market calibrated post-COVID. During COVID, everybody wanted to invest in digital technology, supporting patients, customers. But many of our clients before COVID went bankrupt, or they lost funding for innovation. And what happened to Babylon, probably other companies, they also felt this post-COVID strain of funding. And only now, I think the situation has been improving quite recently. And despite having extremely powerful direct-to-consumer tools, ChatGPT, Claude, that can do everything from checking symptoms to cooking, and you name it, we see the highest demand ever for clinical-grade, certified tools that somebody takes responsibility for. Period.
I know we already started talking about AI and LLMs and many other things, but I want to actually take us back a little bit in history. Um,
Yeah.
about 4 years ago, I think I was doing a small tour through Poland, and for my other channel, HLTH channel, I interviewed a bunch of founders in Poland in health tech specifically, and some of them are super successful right now. So now I know a lot of startups in health tech from Poland. But going back to 2012, I believe, when you started Infermedica, I assume there were not that many successful founders, especially in health tech from Eastern Europe, and all three of us today are originally from Eastern Europe. Tell us, how hard was it to come from Wrocław to Australia, the US, Western Europe, and start selling the product that you built? And what was people's reactions like? Why this Polish guy is selling us a symptom checker or something like that?
No, I love this question. Resonates with me a lot. I think we could spend probably a whole episode talking, exchanging our experience here. Well, where do I start? Keep in mind, Infermedica was founded 2012, so it's more than 14 years right now. I feel like I saw different times throughout this period, and of course, the company changed heavily over that time. But I think it started in 2013. I was a very naive young entrepreneur who just had their first investor. And this investor, it was Polish. He had this crazy idea that he will send his portfolio companies to Silicon Valley. So we can get feedback, learn from entrepreneurs, get the Silicon Valley vibe. It will not be overstatement if I said that I thought California is a city, not a state at that time. But I was kind of surprised. I landed in San Francisco and we had like a full schedule booked of meetings. And the goal was simple. We were supposed to pitch anybody out there, get as many meetings as possible. So, of course, I started pitching the immigration officer. This guy was okay, just welcome to the United States. You can go. Please stop. It was really quite an experience. I slept in hacker houses. I slept in somebody's garage for 2 weeks next to somebody's car. And in the meantime, I was the founder, right? I was the CEO. I was trying to get feedback. I was trying to network with people. And I had this LinkedIn outbound approach. Hello, I'm this, I didn't say that literally, but here I am, this poor entrepreneur from Poland. Maybe, you could tell me how you do business here. This is the symptom checker we've built, blah, 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 blah. And I have to tell you, I was really astonished. I was really shocked how open people were to reply and meet with me back in the day. I was absolutely shocking. One of the first meetings I had was a meeting with the president of the California Healthcare Foundation. I went to this meeting with my investor, and he was, I think, wearing flip-flops. I think I had shirt, but everybody else, when we opened the door, everybody was wearing suits. So I'm not kidding. I felt like a startup version of Borat in America. That was the impression I got. But the openness and this feedback culture was something I have never experienced before. If you approach people with enough of, let's say, modesty and appreciation of their work, they really opened up and they wanted to help you. So that was like this Silicon Valley vibe that I think still exists. Maybe it's changed over time. And also, thanks to my first trips, I met some great people like my medical co-founder, Dr. Ervlo, our medical advisors, Dr. Jordan Schlein, Dr. Ben Rosner. So really fantastic people who helped us educate, learn how to communicate. So the impression back then was absolutely phenomenal. And now when you go back to Poland at the same time, the openness, the innovation ecosystem, completely different story. So my first impression when it comes to US and Silicon Valley was absolutely amazing. I spent some time in the US. There was a push from my investors back then to move to US. I kind of tried to push back for many years. I I thought I should do it, and I think maybe I should have done it. But I decided that I want to stay where my family is. I knew that it would be a very difficult move for my wife. And at the end of the day, Wrocław is a decent place to live. So it was kind of a difficult situation. There are many stories around this, but if you're asking whether that was difficult, yes, you have to learn everything from scratch.
I love it. Maybe you should write a book about all those stories that you encountered.
I have a few, but maybe on a more serious note, because maybe that's also behind the question, it has changed. Now Poland has become like a pretty good champion of startups. We have 11 labs, which is founded by Polish people. We have some really like Doc Planner Group, which is a huge company. But back in the day, I did feel that we were not treated as an equal partner. I'm not speaking about US, but even in Europe, maybe I shouldn't say it, but I once spoke to an investor in Sweden. They were very interested, but the feedback I got, we cannot invest. Maybe if you were not Polish, we would go ahead, but that's not the case. So,
That's crazy.
But the times have also changed. The perception of Poland on the map and what we can build from Poland has also evolved. So I think we're getting to a pretty good spot.
And now you look at Sweden maybe the same way. I'm just kidding. Yeah, I'm gonna switch gears a little bit. So it's gonna be, I don't know if it's an uncomfortable question, but I have to be transparent in this one. So the reason actually Piotr knows about me is because of the critique that I wrote about Infermedica a couple of years ago. I was doing a review of companies, not necessarily symptom checkers, but just I think it was just general healthcare AI space, and it's just trying to differentiate, in particular in terms of accuracy claims. And I remember you had this article, this report that you had 97% accuracy. I was upset because I didn't find any confirmation, and I think I called your company a tech copycat and tech parasite, and I think that's why you're upset. I'm gonna say that I made a mistake because then over the last couple of years, I've kind of learned. First of all, like management, starting with you is exceptional, to be completely honest, because I've written so many pieces about cultural stuff that's sometimes unfortunately going on, especially I feel like when you get too close to like VC circles in Silicon Valley, you get this kind of thinking that you're invincible. And I've written about many companies. I'm not going to go into that, but my point is, I think you're different, and I apologize.
No, well, Sergey, thank you. But I want to say, of course, I appreciate it. But first of all, I want to say that your criticism about the study was well acknowledged and actually well received. So thank you for that. I think it was a few years ago, but it's nice we can have a little clearance during this very recording. So this is great. And maybe if I can say a few words about that, and also, and this is not something I want to say for the purpose of having a nice conversation, but when I reflected on it, I think it might be really the case. The study you referred to, like 97% accuracy, I think it was like back from 2020. I remember when I read about it, when you brought it up, I went to our marketing team and I said, well, guys, look, how come we have 97% accuracy? Even I don't believe it, right? So I did challenge our team back then, and but they said, look, this is the data we received from our client, from our partner actually, and this partner was a Nigerian NGO who provided the decision support tool to community health workers. Probably there was no doctor involved in the loop, and this is why this was so. So I felt, okay, this is really the marketing said we should keep it. I was okay. But this feedback stayed with me. And since then, and since your intervention, I would say, we were much more careful when it comes to the numbers we provide. So you had like a positive impact on the company. And since then, we have published our results in 26 peer-reviewed papers. So we switched from this
Nice. I've noticed that.
study to like a much more evidence-based and solid approach, which is also not perfect. But in that regard, also thank you, Sergei, because your work as a journalist also, also a fair critic, realized that, all right, next time we should do a much better job when it comes to the quality of what we share. So I appreciate it.
No, I appreciate it also. And I think this is what it's all about. I feel like it has to be constructive criticism in the industry. I feel like, and you're inside the industry, you're the ultimate insider, and everybody's like posting press releases. Obviously, they're trying to put their product out there. They're saying all the nice things. So I think it's important to kind of like sort things out, saying, hey, let's just calm down here. Let's not create the hype. And I think you're one of the good guys. And I've been mentioned like about you personally and how you manage the company and just been positive for the whole industry. And I think you also have this like research, maybe / academic mind, like as a computer scientist. So that's kind of like attracts me as well. And full disclosure, I've, when I read all this, I also kind of have a hat of a peer reviewer for several journals. So that's why when I see this kind of numbers without like, and I like really try to get like where this number's coming from. So I'm glad it kind of like became constructive criticism as opposed to kind of, this guy, he doesn't know what he's talking about. It's sometimes the feedback that I receive. I think it's not really constructive when you have that kind of reaction that as if I'm trying to kind of put somebody in the corner or whatever. But this kind of conversation, I think it's like the ultimate, like personally, this is what I'm looking for. So thank you for saying that.
You had positive impact on the
I'm so glad you said that. I appreciate it.
All right, now since you became almost best friends, I want to talk about the bigger picture. So, like Sergey said, every health tech AI company in the space right now is publishing a bunch of accuracy numbers, and in many cases they use like narrow case sets, cherry pick specialties. As someone who's been doing this longer than probably anyone in this space, what's the cleanest way for a buyer or a journalist to call bullshit on a symptom checker accuracy claim?
Yeah, great question. And I think there is no simple answer. First of all, the question is, and there are so many, and this hurts me to say it, we almost don't use accuracy metrics, to be honest. Like, we don't even bring them up during calls with partners. Because like for me, the accuracy is table stakes. Your product either works or it doesn't. Either you take responsibility or you offload the responsibility to your client and you don't worry, right? So there are different approaches. And the first question is, Alex and Sergey, the accuracy of what? The accuracy of triage disposition, safety disposition, final diagnosis, top 3 differential ranking. There's so many creative ways in how you want to approach it. And the problem, I also see that for the triage problem. So here is the patient with chest pain and maybe shortness of breath. Truly, there are no universal gold standards on what to do. And every country will have a slightly different risk profile. In the US, due to different reasons, maybe you want to send directly to emergency. But in the UK, where the structure is different, maybe you want to do something else. So there's like a challenge that it's very difficult to compare apples to apples. And it's difficult to create models for every market you can think of. So, and even if you take 3 doctors, you will put them against the same patient case. And this has been observed in multiple studies. We see it internally. 3 doctors will share 3 different answers where to send this patient. Why? Because their individual experience is different. They saw this patient and he or she died, and this patient maybe had some like fatal like situation. And the risk profile they accept. So it's really even triage is much more difficult than diagnosis, because for diagnosis you have guidelines, you have ICD-10 codes. For triage, it's more like in our health system, given the costs of care, proximity of services, the patient symptoms, what do we do? Very difficult question to answer. And there are also no data sets that you can use to train such algorithms. So the cleanest approach for me would be, one, to be transparent about how you define accuracy. What does it mean for you? And secondly, share a published, peer-reviewed paper based on real-world data, not vignettes, but like the actual patients, ideally prospective study, show what was the, I don't know, how do you say it in English? What was the comparison against nurse triage, or maybe what was the comparison with final doctor diagnosis? And at the end of the day, what you also want to do is simply provide the system for testing, for audit. So health systems clients, the chief medical officer, for sure will want to play with it. And I think this first impression, whether you get the first 5 cases right, is what's gonna be break your deal or win your deal. If the CMO doesn't like the first try, the second try, you can have 99.999 accuracy, and that's not gonna help you.
Yeah, I'd like to totally echo that. For full disclosure, I also have a startup in this space. Well, kind of similar, I guess. We build virtual platforms for providers and patients. And we have an AI tool, and just like everybody else, not as successful as in Infermedica, but we do have clients. And so I was listening to you just now, and I'm like, that's like exactly what my clients telling me, that not many of, let's say, providers. I think patients may care about what diagnosis AI would tell them, but for providers, I feel like most of them, at least on our side, it's not about even like the final outcome. It's not even about accuracy. It's about the process. It's like, how do you collect the data? How do you automate? How does it integrate into workflow? Because that's what they care about. I mean, I think most providers think that they're the ultimate experts, and so the AI is supposed to be the supportive tool. This is what they care about. So it's funny you said like nobody cares about accuracy. I was thinking about like my clients, and it's pretty much the same story, which is interesting.
I think, Sergei, to your point, I think that the time where companies could compete for accuracy are long gone. It either works or it doesn't, and this is like what you start with. And then there is maybe then there's a clinical coverage, how many diseases you have, what is the user experience, do you integrate into Epic or whatever. And I think what's I think extremely important for us, and I really like to think it this way, even your company's values can be a competitive advantage, because the way you talk to people, the way you operate, the kind of evidence you present, even this experience you create between parties can be competitive advantage.
I just want to kind of follow up, I think, naturally. I'm kind of curious, and I apologize, Alex, if I'm maybe getting partially into your question. You obviously started the company, and again, this whole story that, like copycats, just how can it be? Because Infermedica existed for so long. But you definitely started before all this craziness, all this hype about like LLMs and transformers. So you mentioned, I guess knowledge graphs. I don't know how much you can share, but like, what has changed since ChatGPT? Like, are you still relying a lot on those kind of like decision trees and knowledge graphs just because, you maybe want to be like, I've noticed in my work, sometimes you just want to be kind of like concrete. You don't want to even have a slight possibility of hallucination or, whatever limitation the LLMs have that we all know. Or are you using some kind of like model layer for LLMs? Have you incorporated something of like recent developments in your work?
Yes. So first of all, great question. I'll just say again, on the market side, what we see that has changed is this standalone symptom checking use case is gone. We see it in usage, we see it in client instances. Everybody moved out to ChatGPT and others. But we see uptake in usage in places where we are deeply integrated into triage system, call lines, booking platforms. So it's like the feasibility for the triage is still here. So the approach we are taking has a very fancy name, and it's called neurosymbolic approach to AI. Neurosymbolic means we want to take the best of two worlds. Symbolic, Sergei, as you mentioned, is the knowledge graph that we have. So the knowledge graph is created by doctors. We have a very solid ontology with SNOMED CT, ICD-10 codes, about 1 million of connections backed by evidence and probabilities. Again, clinician-built and validated. This symbolic part, symbolic probabilistic reasoning, is certified as a medical device in Europe, but also in other countries. Continents, countries, we're trying to secure the medical device, and we take responsibility for it. And now, the latest thing that we are developing towards is what we call conversational triage, chat and voice. And what we do is we combine the symbolic part with neural part, which are like large language models. And we use large language models as we can have different names for it: empathy layer, conversational layer. Probably everybody's using pretty much the same terms, but the clinical reasoning is still probabilistic, symbolic, no hallucination, can be easily maintained, can be audited. There are many advantages of having it based on a knowledge graph. For example, if you want to add a new condition, a new disease, you probably need to retrain the whole LLM to incorporate literature. In our case, it's a matter of maybe a couple of days of our clinicians' work. So it's very appreciated by the customers, because you can make customizations and configurations much easier, and you have full control and clinical governance behind it. But on top of it, we are putting the LLM layer. So what we want to launch it's already launched, I would say, but not yet as a medical device, is a voice agent and chatbot that combines this neural and symbolic world. So LLMs for understanding the patient, structuring input, but the whole clinical reasoning will be happening on the probabilistic grounded knowledge graph thing. And just to clarify, this conversational triage, as we call it, we also plan to have certified in the next few months. So this will be a Class 2B medical device as well. And that's our most important product thing that we're working on.
Nice. Just as a quick follow-up, we're talking about LLMs and foundational models. Do you consider, who do you consider if it's okay for you to share, who do you consider your competitors right now? Do you consider all these big guys kind of elephant in the room, I don't know, OpenAI, I guess on the technology side, and maybe Epic on the medical side?
Definitely not you, Sergei.
I know.
But
nobody knows about
research. Maybe this is who we're losing all deals to. Maybe I just didn't realize that.
That was my next question, but yeah, let's finish this one.
Yeah. So it very depends on market. In the US, there are a few more of a startup-like companies that provide a similar offering. Probably all of them. In the UK, this will be another group of companies. In Germany, this will be another group of companies. So it will still be. So in Europe, this will be companies certified as medical devices. In US, it would be more as growth companies. We don't. So when it comes to OpenAI, for instance, or Claude, to be specific, I don't see them as competitors right now. They are not in triage space, and I don't think they have much appetite to take the liability for mistakes when it comes to sending people to emergency. Even when we had some intersection around some projects, they would oh, no, maybe you did this part, and we just provide the LLM layer. That's the way to go. And certifying that as medical devices would be very, very tough, at least now. What I see, though, in terms of big players, and that worries me a little bit, but this medical device barrier or mode is still around. I think Google is most active when it comes to building actual deals in patient navigation and even sometimes patient triage space. I think we might have lost one deal to Google, not in the country of our prime activity, but nonetheless, a very large government contract has been taken over by Google. Not a medical device again, and I'm not sure if it's still on, whether that performed, where that worked, but it shows that despite what big guys are saying, maybe they do have appetite for government contracts. Maybe they do have appetite for building end user and patient facing solutions. I don't know. We're gonna find out.
Okay, let's talk a little bit about the fun part, the money. Uh, can you tell us more a bit about the uh, your investment history and how hard was it to raise funds? Are you planning to raise any other rounds? And also the usual question, what's the exit path? Do you really want to do an exit, or maybe this is a generational company you're gonna pass along to your kids?
Ha! I wish that was possible, Alex. No, I don't think I'm in this race. Uh, no, so I think the story is, again, it's a very, very interesting question and long story, but raising funds from Eastern Central Europe was much harder, I assume. And you know probably that yourselves. The times have changed, but overall we raised around $50 million since 2012. The last round we had was announced early 2022. It was our Series B, and we have not raised additional funding since then. We are yet to see what's next. Whether we're gonna go into this venture approach, I'm not quite sure whether I would be happy to have more money in my bank account, the company's bank account. Of course I would, because then I would invest in quite a few things. So the situation is that we'll see, maybe more of strategic investment. And also when it comes to exit path in the future, and we are a venture-backed company. So of course, at some point, you need to return the money back to your shareholders. You also need to return the money back to your employees, to everybody who committed to building the company through like 14 years. And we really have people in the company who worked for 14 years. So this is like remarkable. It's not me. There are like more. I think where that's gonna go, and we are not at the point where we are selling the company. We are in a pretty comfortable situation because I think how we call it is default alive. I think this year or next year we will hit break even. It might be a matter of even maybe one or two larger contracts that we hope to sign. So there is no runway ending from this perspective of funding, but of course we are running as a lean organization. We don't have like excessive budget to throw big parties at health or whatever other events. So we just need to work with what we can earn, and it's a fair approach. And what's not very intuitive, guys, our funding history, I think, saved the company. Look at other companies that raised like hundreds of millions. Don't want to name anybody. The fact that it was difficult for us to raise money over time, this disadvantage to like raising money in Poland or from Poland, it resulted in a situation where we don't own too much money to anyone in particular, right? So, and in that situation, I think it's slightly more comfortable to manage the path forward.
I also think it goes to show like you as a maybe Eastern European person to kind of like, oh, I have to discipline. If I ask for something, I have to return it, because I feel like people I'm writing about like Munjal Shah and Ali Parvz, all those guys. Honestly, I don't like, based on their behavior, I don't think they have that intention. Like you look at them, they have no intention of returning the money. For them, it's like you get in, you turn it over, you start a new startup, you ask for more money. It's like I feel that's been a big problem for venture capital in general, like health tech in particular. And so I'm happy that there are people who, like yourself, saying, "Oh, we actually have to return this money," which is like, what? But
I
yeah,
mean, I think that's the only, let's say, respectful thing to do. You have
yeah, of
people
course,
trusted you, they build their funds on your story. I owe them a lot. And of course, investors are decently paid, and so on. But even more importantly, so for our team members, employees, at some point they want to buy this new house, new car, send kids to school. So it's part of the responsibility in the long term.
yeah,
And
good
even
for
though
you.
you said you're not selling the company obviously right now, but looking ahead in the future, who do you think would be potentially a good acquirer? Whether EHR vendor, pharma, payer, who do you think would fit best?
Yeah, yeah. In that strategic acquisition angle, I would think about two groups. So one group would be for sure somebody who values the data we collected, the knowledge graph, the feedback loop, the millions of encounters we structured. So something that can be like a gold mine for further model training, especially that triage data sets are scarce. There are basically none of them. So either somebody who needs the data and ontology and clinical validation to expand that forward, and this is one. The second category, so likely maybe somebody building or scaling their own models. Second category would be somebody who wants to get into enterprise market with that kind of product, expand their offering. They want to use our 100 plus partnerships we have, the technology that exists that's certified, use our pipeline that we've been developing. So guys, in our pipeline, we have over 140 deals that we're actively working on. So like the interest is really large. So it might be another company that wants to scale into this vertical, but is missing the technology and the access to market we have. And I don't know what these categories are, but probably not payers, not pharma, more like a tech companies building clinical models, or I don't know what, some companies interested in AI powered primary care or other types of care. As you can see, I have not mapped it out yet.
I was gonna give a little praise to your sales team. Alex mentioned my humble startup. Like every time, like especially if it's a relatively sizable health system that we're trying to sell, we always hear this feedback. Oh, you guys do the same thing as Infermedica is doing. There are people already called us. Why are we talking here? So, I mean, kudos to you. I think for building all these teams within the organization. I don't know. And I've heard this from several people. Like sales team is really, really strong. So I don't know. I don't know if there's a question there, but like.
Thank you. So yes, so we're very lucky to have some really amazing people on our side. Thanks.
I'm gonna ask you maybe not very very intelligent question, but what's your bold prediction for AI in healthcare within the next few years? Because everything changes so rapidly, and I'm just curious how you see the change that AI is going to bring specifically to this industry.
Yeah, and thanks, Alex. Well, I'm not sure if I can say anything innovative here, but what I always say is I believe that in the next few years, just as we'll have self-driving cars with a driving license, we'll have self-care agents with some sort of medical license for sure. So I know we are saying often, oh, AI will never diagnose patients. No, I think it will for sure. And it's a matter of maybe 2 years. And I'm not saying that it will diagnose every condition, but I can see a group of like 20 to 30 low acuity conditions, common cold, bladder infection. So things that can be easily automated, things that can be even diagnosed over a teleconsultation. And I think there will be countries or places where AI will be licensed as a medical device to treat very minor health problems. freeing this time to doctors so they can take care of patients who really need more urgent assistance. So that's my prediction that AI will diagnose something pretty soon.
Piotr was saying that, and I think it's the right argument, that I think we still, at this point in time, still need a human in the loop. We need experts, we need nurses. Even when we're talking about AI and, in your case, knowledge graph and sort of combination of sort of LLM layer, and, whatever you started with, like knowledge graph and all these other algorithms. So it's funny you say that, but I think your differentiation is that you actually have all these experts working together with technology. So we've had this example of Doctronic being, as you guys know, approved for completely autonomous refills, and I wrote about it. There was some problems, but whatever. So it's funny because, in my opinion, in my view, like when I started preparing for this interview, that actually Infermedica was actually different in that way, that they actually still value this sort of human expertise and humans in the loop. So it's funny you made that prediction. So I don't know how you can square that, and if your company is actually ready for that stage.
No, we are not ready, and this is not what I'm saying. I'm just saying that somebody will get there, and the way we want to get there is, of course, starting with assisting doctors first and collecting data, having human in the loop. So we are not there at this stage, and I'm not sure if there's anybody at this stage yet. But I want to do it by the book, in a way that gains doctors, nurses approval for what we want to do. And at the end of the day, it should be something that frees up their schedule so they can really take care of the patients who need their attention most. And once that technology exists, that I hope we're going to contribute to building, I think that should be class 3 medical device, not even 2B. So the highest class you can get as a medical device.
All right. Let me finish up. I don't know if there's a question there, but we started with how we met, Piotr. I'm just gonna finish how we kind of met in Las Vegas Health Conference. It's kind of interesting because I don't think you see very often CEOs kind of giving away plush toys. In this case, it was what was that? What was the toy?
The unicorn.
The unicorn, yes. It was Infermedica unicorn. So he was handing unicorns to people, and Alex and I stopped by and just had complete informal conversation. So I think it kind of goes to show that how sort of hands-on of CEO and founder you are. And I think, my personal opinion, I think the more people like that, the more sort of integrated management we have together with employees and just living the same life and kind of having the same experience with customers and their own employees, I think the better of our industry would be. Because as I've been writing in my work, unfortunately, we have a lot of places in the industry where that's not the case. So I give you full credit. I applaud you, and thank you for doing what you're doing.
Oh, thank you, Sergei. You're too kind to me today. So thanks, thank you for that. And I think it's interesting. It's maybe also part of the culture we are all from. I want to work hard. I want to be on the ground. I have low ego. And, it's for me, it's not even a question whether I should be at the booth handing the unicorns. I think it's my responsibility to be at the booth at Health and hand the unicorns. That's my perspective.
I don't know,
Thanks,
Piotr,
guys.
what you did, but yeah, Sergey being kind to someone, it's rare. So that's really fun to hear. But yeah, thank you so
Definitely
much,
not kind to
Piotr.
Alex, for sure. Yeah.
Thanks,
Looking
guys.
forward
So
to
much
see you
fun.
at the next conference.